I'm about to ask you a series of about 4 questions, and I just want you to be as honest as possible with these questions. Okay, this is a safe place. You can be as open and honest as you want to. My first question is, are you having thoughts of harming yourself?
Not always, but there are some times where I do think of it. But it's not consistently.
Okay. Do you intend to harm yourself?
Isn't it the same question?
Like, do you have any plans to harm yourself?
I mean, I haven't had thought out plans to do it. I don't necessarily have any plans or intend to do it.
Okay. Have you thought about it enough to think of a plan on how you would harm yourself if you were to?
I mean, probably the easiest way would be to take pills, and then I think about like my family wouldn't have to clean up anything.
Okay. Do you have access to pills where you could harm yourself with them?
Well, yeah.
Okay. Thank you for taking the time to be honest with me.
This one was kind of a tough one for me to go through. I think in a real life situation, I would have been deliberate but slow with my recommendations, simply because at this point I don't feel very comfortable with going through mental health conversations, but it is something that I need to get comfortable at doing. I would assess that this patient, if she were real and had responded in that manner, she would be somewhere in the yellow stage with growing concerns. She talked about harming herself, even though she posed it as she hadn't seriously thought of it. That could almost be under the same lines as joking about it. She clearly had thought about it enough to have a plan for committing suicide and had access to those things. So we were even nearing, if not in the red section of needing to take action for this athlete. So my first recommendation would be to have the conversation and recommend that she gets a mental health evaluation. And then I'd be at the stage where I need to follow up with her to make sure that that is getting done. Because of the way she approached it, and in reality, that actress was really good, I think, at displaying a real life scenario with those. Because of the way that she did it, it would have been hard for me to recommend or make the call myself to the National Suicide Hotline. Because I feel like I would have been accused of overreacting. Now, context is everything, so that I think that changes the way we interact, and the outside information that she could have added to that might have made me feel like she was more in the yellow or more in the red. But I would have to say this patient is somewhere in between, and those are the recommendations that I would be doing. Taking a step outside of that scenario and reflecting on this experience, that actress was my wife, and it was tough to hear someone that I cared about, even though she was just acting. It was tough to hear, the way she expressed those things, because I know that even though it's not equal, there is a level of care that athletic trainers hold for their patients. And if one of them had answered those questions in that manner, there is an immediate emotional response elicited on my behalf. And it was difficult for me to control my emotions in reacting to her in order to focus on her problems and make the correct recommendations to her so that she could get the help that she needed. Because if I had reacted, it would have been a bigger shift in the focus on my emotions and how I was feeling about it. And that would have then in turn influenced her follow-up responses. If the athletic trainer is not, calm and collected and reasonable and inviting a safe space and inviting them to speak and inviting them to describe their feelings, they might in some ways become defensive or find reason to make you believe they're not going to do it, or the focus might shift to you being the reason why they don't, or they feel the need to convince you they're not going to commit suicide, even though it might not be real. They're just telling you what you want to hear. So it was interesting to experience those emotions and know that I needed to stay calm. And in the back of my mind the entire time, I'm thinking, I'm having all of these responses and this is just a fake scenario. So that was surprising to me. Yeah, it was hard hearing the responses. It was hard recommending actions. I initially, thought we were just going to be reviewing that. And so I practiced with her, what that conversation would feel like. And it's difficult. It's difficult looking someone in the eye and saying, okay, the next step that we are going to take is calling a mental health professional and making an appointment right now. I think in a real life scenario, I kind of mentioned this previously, I think in a real life scenario that the way I need to get more comfortable phrasing it, because depending on how you approach that subject, they could become defensive. They could, get in their shell, and there's still a job that needs to be done. And you need to make sure that that bridge to another allied healthcare professional is formed. And then, short of walking them to the door of that facility, there is a gamble if you were to let them go out the door. So those are some other obstacles that I'm facing. And I know that that's a little bit beyond how I felt recommending those actions. But I think that it's important to note that I felt uncomfortable and that I understand how important it is to be comfortable with this, because it's a really big deal. And if it's not handled appropriately, it can go really badly, very badly.